Kate Burke, Spokane City Council.
Ben Wick, City of Spokane Valley.
Andrea Frostad.
Citizen representative.
Bob Lutz, Health District.
Mike Riley, co-interim administrator.
Linda Thompson, City of Spokane Valley.
Brian Beggs, City of Spokane.
Chuck Hafner, appointed citizen.
Karen Stratton, City of Spokane, City Council.
Michelle Fossum, Legal Counsel.
And Pittsnogle, Recording Secretary.
The commissioners will be a little late this morning. They won't, this afternoon, they won't be here until about 1 o'clock. And so we'll continue with the citizen input. Thank you. So Jacqueline, we'll start with you, please.
Jacqueline Gallion, City of Spokane Valley. At the last month's meeting, your legal counsel confirmed what I have been telling you all for a year and a half. Ms. Fossum properly described that for an involuntary binding exclusion order, it cannot exceed 10 days, and the excluded student must be informed of their right to challenge and petition for relief in Superior Court. Then astonishingly, Ms. Fossum stated that we never reached the binding order level during the Mumps exclusion, and that the exclusion was voluntary. Let's address that at face value. If we parents had been requested and agreed to exclude voluntarily, why would we have been here month after month pleading to get back into school? Why did this board have a special meeting to explore if there was a way for you to lift or modify the mandatory exclusions? If they were voluntary, the document used to kick my child out was titled Mumps Exclusion Order. This document was signed by the health officer and cites WAC 246-100-036 for authority. This order violates the time frame and fails to notify the quarantined persons of their right to petition, which means all the Mumps exclusions were illegally involuntary detainments under Washington state law. Please understand that this is no longer a vaccination issue. This is about the proper legal conduct of a government agency. In my public records request, I have emails showing that the health officer wasn't involved in deciding to exclude as a disease control measure. His signature was added as an afterthought. And I have learned the district's new zero-tolerance exclusion policy is required by an intergovernmental agency agreement with the CDC to protect funding, not for any infectious control purpose. I also have emails showing the Spokane Regional Health District had named this the Marshallese outbreak. This board has legal counsel, the Spokane Regional Health District has attorneys, and so does the Department of Health as an entire legal department. Is it reasonable they didn't know they were in a violation of statute? It appears that this agency conducted a long-term, intentional, cooperative, and coordinated campaign to conceal this illegal behavior from their governing board, as well as defrauding the public of their rights. This deception would still be occurring if no one has asked for a definitive answer about voluntary or involuntary. This fraud was accomplished by both failing to disclose the facts and actively by conducting the sham special meeting. How could a meeting to overturn a mandatory exclusion not include the fact that exclusions weren't mandatory? Beyond this, Spokane Regional Health District personnel planted stories in the media to promote the fiction that the notification box on an exemption form constitutes an agreement, which it does not. The right to exempt is not conditioned on agreeing to exclude. Board member Stratton asked what she can do to help us. What you can do is require the district to follow the law.
Thank you.
If it is a voluntary request, I'm almost done. If it is a voluntary request, then ask us. It is not, if not, take us to court. We should never have been here. We should have been in school or arguing in front of a judge. I welcome the chance to show a judge that exclusions don't work and are dangerous. Is this the proper behavior of a government agency to its oversight board and to the public?
Jacqueline,
Thank you.
Chris Eifert. Is that correct, Chris? Is that how you pronounce the last name? Perfect. Okay, thank you.
The Spanish flu of 1918 globally accounted for an estimate of 500 million infections and 50 to 100 million lives lost, more than had died in World War I. Over 11,000 fell ill in Spokane between October 1918 to October 1919. 562 had died. This is a quote from Dr. Rob Lutz, current officer for the Spokane Regional Health District and Asotin County Public Health. 100 years ago, St. Luke's Hospital was so full of flu patients it could take no more. At Deaconess Hospital, 3 whole floors were filled with flu patients. Sacred Heart Hospital had set aside 140 beds for flu patients. All were occupied. The city's emergency flu hospital, a former hotel, was filled with 90 patients. Over the next 10 years, Congress plans to cut $1.35 billion from the Natural Prevention and Public Health Fund to include a 12% decrease in the CDC budget. Last year, a year ago approximately today, this board adopted your resolution 1709. And in that resolution, it said, you will protect the public from communicable diseases by increasing immunization rates, including, though, restrictions on exemptions to immunizations requirements. Vaccine-preventable diseases such as measles, mumps, whooping cough are still a threat. They continue to infect children and adults, resulting in hospitalizations and deaths every year. Outbreaks of preventable diseases are exacerbated by increasing populations of unvaccinated people. I am not here to quote an opinion or a Google or a book. I'm here to say thank you. I thank this board. I thank the Chief Officer, Dr. Lutz, because you have been protecting our community and our family. And Dr. Lutz, I too visited the cemetery that you spoke of all the dead infants and children in a Northern California graveyard. And I just appreciate all of you for the work that you do and for how you keep us safe. Thank you.
Thank you, Chris. Carol, Allen, please.
Carol Allen, City of Spokane Valley. First of all, I didn't know Tori was retiring today or having his celebration. And I worked at WSU for years. And I remember when you were a really young man with a full head of really pretty hair. I think it was red-ish. And I want to congratulate you on all your years of service. Thank you.
Carol, I will not take time away from you for all those accolades you gave Tony. So
Thank you very much. Okay, I'm here to thank the Spokane Regional Health Department and its employees for the work that they do to keep the community safe. You monitor communicable disease and provide information to help citizens protect themselves and their families. You provide immunizations to people who cannot afford them. You educate the public on the need for immunizations and help enforce state laws concerning public health. For many years, you have supported a needle exchange program that protects every citizen from HIV and hepatitis C. You manage a methadone program that prevents deaths and crime by providing alternatives to opioid consumption and support for recovery. Many people are under the false assumption that this service is free. It is not. Participants pay for their medication, just like they do anywhere else. You inspect food establishments and provide education to food handlers to assure that the food we consume is stored, handled, and cooked in a safe manner. You monitor the quality of our water to assure it is clean and wholesome. Spokane Regional Health Department plays a key role in city-county emergency response to natural and human disasters. Through the Medical Reserve Corps, you provide education and resources for preparedness to community members. And that includes things like the good-to-go bags that have been created for seniors who may have to leave their homes in a hurry. Spokane Regional Health Department manages a child and family services program that includes nationally recognized nurse-family partnership that has demonstrated effectiveness in preventing child neglect and abuse for many years. These are only a few of the many services the Spokane Regional Health Department provides that keep every citizen safe. Public comments here tend to focus on only a small part of your work. I want to remind the public of the many crucial services you provide and to applaud the work that you do to protect our community. Thank you.
Thank you, Carol. Christian McGorry?
My name is Christian McGorry. I'm the assistant professor of biostatistics at the Department of Biology.
Christian,
at
I think you
Eastern.
can put the mic up a little bit further so you won't have to bend over.
Okay, thank you.
Okay, there. Is that better? Yeah.
Okay. So I am the assistant professor of biostatistics at the Department of Biology at Eastern Washington University. I am also a disease ecologist with experience in the statistical and mathematical modeling of infectious diseases. Over the last year, I worked with a biology student, David Guyan, on a project to investigate the effect of school exclusion policy on the duration and magnitude of mumps outbreaks in schools and the potential impact of relaxing such policies. The purpose of this project was to answer questions raised about the policy during and after the large mumps outbreak that occurred in Spokane County in 2016-17. We created a mathematical model of unvaccinated children in a school, assuming the current rate of MMR vaccination. We modeled the mumps outbreak by introducing a single asymptomatically infectious student and tracked the progression of the outbreak. We implemented school exclusion policy in our model by moving a set proportion of unvaccinated children from the school to their homes at a specific time after the detection of the first student with symptoms. We allowed for the re-entry of unvaccinated children after a specific interval, potentially before the time currently set in policy, which is 1 incubation period after the last detected case. We found that school exclusion policy was an effective way to reduce the overall number of cases, especially when implemented quickly, 0 to 4 days after the detection of the first symptomatic case, and comprehensively, at least 90% of unvaccinated children removed from school. School exclusion did not reduce the overall length of the outbreak. However, allowing re-entry of unvaccinated children before the end of the outbreak obliterated this benefit, resulting in all children being infected in the model, regardless of school exclusion. In addition, premature re-entry of unvaccinated children to schools increased the duration of the outbreak, in some cases doubling it, when compared to current policy. This happens because unvaccinated susceptible children returning to school reignite the outbreak, just as adding more fuel to a fire would keep it from burning out. Our results support the current school exclusion policy as an effective public health intervention to control infectious diseases in school settings and provide a concrete assessment of the risk of selectively relaxing such policies. Thank you.
Okay. Thank you very much, Christian. Derry Van Duzen, please.
Good afternoon, everyone. Thanks for having me. I've spoke to a couple of issues before around my own personal story. I've actually been motivated since I was a little kid. I had polio when I was a toddler, because my mother had read up on what to do and asked her doctor, I'm sure. She moved my arms and legs, and he had her father involved in it and did it a lot. And there's a picture of me somewhere when I'm like a 4-year-old with my cowboy hat that I always wore, shirtless, and I was really crooked. But over the years, hey, I'm fine, and I've never had any problems, and I'm 73 years old, and I can hike and cross-country ski and do whatever I want. That's a mother's love. And I know there's mothers in this room, a whole lot of them, that love their kids as well. I actually remember when the Salk vaccine came out, and I was happy that the other kids, I didn't remember what my mother did. I was too young, but I was just happy that the vaccines were available. And so that is my little story. So I would just ask the board to go forward with the best science that they have. I've understood the board, I see the expertise here in the board. And I just would ask them not to listen to people that are kind of really pseudoscience or following something that you think is, that really isn't quite right, because you are looking out for the rest of us. Then one other thing I'm going to throw out is the Camp Hope down by the City Hall. I worry about those people. My wife brought them some blankets and sleeping bags yesterday, but I wonder if they have flu vaccines. I just wonder if we could step up and do something about that. I know you can't do everything. And then, as long as I'm talking, and we haven't run out of time yet, I'm going to say, when I think about health, I think about community health. There was a fantastic article in SR, Spokesman Review the other day by Jerry White of the River Keepers. And I thought way back to Expo 74 and how we had the whole environmental theme going, and maybe to piggyback on that and even have a website if necessary, a Facebook page on the river. I'm sure they do, but as far as the county health input, to have a clean river going through our community, just as an example, because the planet's in trouble right now. I think that was about all I had to say, but I also want to thank the board. I also want to thank the board for providing health care for me when there were periods of my life, like in college, where I didn't have any. Thank you so much.
Thank you. Bill Lockwood, please.
Thanks for having me. Probably won't need to put up the signs. I'm not going to be very long. My name is Bill Lockwood. I've been a physician in town since 1992. Excuse me. And I'm currently the Chief Clinical Officer at Chaz Health. We have about 80,000 patients, so about 1 in every 7 people in Spokane get their health care at Chaz. And about 20% of those are pediatric patients. And I'm really just here to echo what most of the other people have said. I believe in making both personal health decisions and certainly population health decisions on evidence, not emotions. I think the evidence is very clear that immunizations are safe and effective. Frankly, if we based the decisions on evidence, we'd make vaccines mandatory before kids could go to school. But short of that, clearly, if they're not immunized, they need to be kept out of school for the full incubation period of the infectious illness they've been exposed to. So I just am here to encourage your efforts and applaud your efforts at using evidence-based medicine to make decisions about population health.
Okay. Thank you very much. With the board's permission, I would like to have the agent's report prior to my own. If you're prepared to do that, Mike, I would appreciate it very much. So number 4 will be number 5, and number 5 will be number 4, please. Okay, thank you.
You're welcome. Thank you. The agency report today is going to include myself giving a short administrative report, because I know you have a very big agenda to get through this afternoon. Dr. Lutz will come up and give a health officer report shortly after that. We'd like to move the financial report that I promised I was going to start doing right away. I'd like to move that down to the resolution 18.9 when we go down to the compensation project talk. And then the legislative report, she'd like to move to resolution 18. I think it is. It's the, I'm on the list, oh, no, the 9 and then 10. So we want to move them down to 9 and 10. That's where we'd like to move those other two parts of the report.
Okay.
So, first thing I want to talk about is a couple personnel changes going on here at the agency. We have a group called Family Resource Coordinators, and they work in the Birth to 3 Infant Toddler Network program. I believe they came and talked to this board a couple years ago and talked about the work that they do. And the state is doing a transition where the current structure, we employ the Family Resource Coordinators, but they're housed many times and do the work out in providers' offices. So they're out working in some subcontractors like the Guild School and the Youthful Horizons and then some other agencies. And so the state has came up with a new structure where they want the Family Resource Coordinators to go, merge out into the actual providers. So then they're going to be employed by the providers and do the service at the location. What this affects us is we have currently 8 FRCs that are employed here at the health district that need to transition out to the community by June 30th. So on July 1st, they're all got to be transitioned out to the place. They're all aware of it. The union's aware of it. The whole thing's been talked about for 2 years, and over that 2-year time. But I just want to make sure the board is aware that there is going to be some shifting of employees out to the community on those. Another personnel item we have is, if she's here, stand up, right back here, is Misty Challoner. She is our new Treatment Services Division Director. I know we were without one for a few months, and so she's standing right back there in the back. If you want to,
Missy, come right up here so we can see.
She can come right up here if you like. Come on up here. Come on up, Misty. Yeah, and so she's not only the Treatment Services Director, she's also part of the Executive Leadership Team and attended a meeting, was very valuable at the meeting that we had on Tuesday and given some good input, and looking forward to working with her on the Executive Leadership Team as well. So welcome. The other things I have are pretty much facilities updates that are going on. We have asked and been told they can ask the Veterans Administration that's using our 4th floor, or part of our 4th floor, that we need that location back. It was a contract with the county that we, whenever we have empty space in the building, our first offer is to the county to see if they want to use the space. They used it in various places. This is the last group that's using it that's a renter here in the agency. So we'd asked them 5-6 months ago if, because of the growth of the health district plus some new grants that are arriving, that we really need that location. And so we gave, according to the contract, it said that they would leave on December 31st. They asked, and we gave permission, of course, for them to stay till January 31st, and I have been informed that they have found another location and are working on going out of the spot. Internally, what we're going to do with that spot is it's really going to be Ann and myself and Ray sitting down with the other division directors and figuring out the best use of the space, not just short-term of these quick little movements here and there, but long-term, 5 to 7 years out of what's the best group to put there for the agency going on. So I just wanted you to be aware that that is going on and happening soon. The next one we have is, if you've been out on our west lawn, you'll see there's construction going on out there. What that construction is, it's a West Lawn shelter that's being put in out there, or as the facilities guy, he likes to call it a gazebo. What this is for is, now that we've got up to 1,000 patients on our treatment service program and in our opioid treatment program, there is people out everywhere, out and about. We were overcrowding sidewalks. A lot of the ones were standing across the street at the other veterans building across the street and blocking traffic into the driveway. So the request came, is there a better place to let our clients stand where they're out of the elements and not tracking in a lot of mud and debris that comes with all the leaves and the other stuff that are out there in the lawn. Not to mention the fact that by standing in some of the areas of the lawn, it was making mud puddles and creating quite a mess for the building facilities. So this is scheduled to be completed by the end of January, and it gives a spot for the clients to be able to wait for their turn to move into the clinic. So.
Question here, Mike.
Yes?
Are there going to be any benches?
There might be, we had picnic tables are out there now that are locked down. There might be some more of those moved over there to lock down. The one question that has came up from many was whether it's going to allow smoking, and it's still a non-smoking area. So there's like 3 designated smoking areas of all Spokane County campus, and none of them are in that field or that grassy area out there. So it also gives our security guard that works mornings a better opportunity to see what is going on out in there by keeping them in an area.
Any other questions of Mike?
All right,
Okay.
and that's all I have as far as administrator report. Dr. Lutz.
Thank you, Mike.
Well, good afternoon. I'd like to ask you to look into your packets, and you'll see a document that looks like this. And we put this together as a function of past conversations, past Board of Health meetings, and I think a little bit of confusion around the concepts of voluntary versus involuntary. With respect to exclusions, it's not appropriate to say that exclusions are the voluntary or the involuntary component. Really, when you look at that document, you'll see that the terms are really in reference to the term compliance. And so when you look at, again, what health officers, the statutory responsibilities of health officers with respect to infectious outbreaks in schools, they can, again, call upon the school to perform an exclusion. And that exclusion is considered a voluntary effort based upon the understanding and the expectation that people will comply with that. Now, it's done in the form of an order, and that, again, is based upon specifically WAC 246110 that says that when a exclusion is stated, it will be given in the form of and substance of an order. So again, it's the semantics and the nuances of the language I think are really important here to understand. So when my predecessor declared an order for schools to comply with exclusions, it was a voluntary aspect around compliance, assuming that, again, people would comply with that request. It was not an involuntary order. So if you go to the third column, you'll see that when the concern exists that there will be non-compliance with the order for an exclusion, then you go, again, to a much more, if you will, aggressive form of ensuring that that exclusion is followed through with. That's when you bring in the sheriffs. That's when, again, going to maybe level 4, when you actually, again, involuntary quarantine, where, again, you actually have to go to court. So I think the important take-home for me when I've looked at this, and believe you me, I've looked at this a number of times, because the nuances of the language, I think, are such that it can be very confusing. Voluntary versus involuntary with respect to compliance, compliance with respect to following through with the health officer's order for exclusion, not voluntary or involuntary exclusions. If at any point in time the health officer was concerned that there would be non-compliance with the order for exclusions, then it becomes, you take it to the next level. And that's, again, what I think that document in front of you kind of walks through. Does that make sense? Questions? Yes, sir.
Quick question. Dr. Lutz, across the top row of your table, you have your 4 columns, and based on what you just said, in your second column, LHO, the local health officer, request for voluntary quarantine. Isn't that really, then, like you said, isn't that an order? Like, all of it comes in the form of an order from the local health officer?
Yes, sir. So again, that's where I think the semantics are really important to take note of. You know, again, so if I reference WAC 246110.020 under 2B, provide the superintendent of the school district or the chief administrator of the child care center or their designees a written decision in the form and substance of an order.
Any other questions, Bob?
Yes.
Breen?
Yeah, so I read the 246-110 that you referenced as basically telling a school district if a health officer issues an order on these things, the school district has to cooperate with the order. That's how I read that. But I'm still, where I keep getting confused about is in an exclusion, schools exclusion ordered by the health officer, are you ordering that student to not go to school or not? Or are you recommending that they don't go to school, and if they comply, then you don't do anything further? Because it seems that's where it gets, I think people feel like, well, who is excluding me, the health officer or was the school? And the school has to follow your orders according to this WAC.
Right.
So they're just an extension of you. But the student, do they have to or not? I mean, I think that's the part that I've been confused about. Because it seems like if we're ordering someone to stay out of school, then they have some due process rights to appeal that if they want to. But
I guess I think the point is well taken, sir, and I think, again, in my conversations with both Dr. Lindquist, who is a state epidemiologist and, again, a previous health officer for a number of years, as well as a state health officer, it's their understanding, it's their recommendations that, as stated in that document, which is, again, the reference that they referred me to, that we, as the health officers, request that the schools exclude the students. Okay, at some level, we are giving them that kind of safety net, so that we're taking, again, we as the health experts, they defer to us to make that decision. Okay, obviously, if they went contrary to that and something untoward happened, then they'd potentially be at fault and could be held at risk. So again, they defer to us to make those decisions. It's a request, but it's a request in the form of an order. And again, it's because of the semantics of 246-110. So again, my understanding, Brian, is that an order, but again, it's a very strongly suggested request, because even at the top of that document, you see that it's labeled as request for voluntary quarantine. So it's a request, but it's stated, again, per other WACs, it has to come in the form of an order.
so I guess my question is, when students are excluded, are they given the documentation that says, if you, for scientific reasons, think differently? And just to be clear about this, I'm all supportive of the health officer using science to make the decision. So I'm very much in that. And it's just that if someone wants to contest that science, where is their ability to appeal that, and what information is given? I mean, I don't know that there is any information given. It seems like there is an appeal process in the legal structure, but it feels like we're saying, well, we're making a request to the school district, so if they do it, then it's really, they can go through the school district policies of appeal as opposed to the health officer policies of appeal. And maybe it's not that clear, but that's what I want to be clear on. If someone disagrees based on science, where do they go to make that appeal?
Yeah, and again, I think that as to whether or not the schools provide any specific documentation as to next steps, as to recourse, I don't know. I can't speak for them. Again, however, I would suggest that given, when you look at the order, and again, the parameters that are defined in the order as to why the students are excluded and for the period of time for which the student is excluded, for me, that again sort of fits in that second column. It's still a request for voluntary quarantine. You know, there has not been, in my mind, based upon what I'm reading here, sort of going to that next step where, if you will, due process is part of the conversation, because I'm not, as I said, involuntarily quarantining. I'm not actually, does that make sense?
Michelle, do you have any comment to make?
perhaps I'll try and help. So I think the first thing to recognize is that the WAC process for issuing the exclusion order doesn't give specifics about the mechanics. So the mechanics then come from what's on this process chart, which is broader than just school exclusions. It has to do with everything from TB or other types of things that may be going on. So we've not ever had to go past the order to the school, but here's what I envision would happen based on using these rules for other types of exclusions. Let's say that a student said, no, I'm showing up at school, then I imagine I would get a call from Dr. Lutz who would say, we need to take more serious action with this student. At that point, we would get a court order forcing that student to stay out, and with that court order triggers all of those timelines to have the court look at it. Like I said, there's very few circumstances where this has occurred in case law or anywhere else. Certainly, I've not ever had to do it in anything other than TB. But you try and get voluntary compliance. We want, least aggressive mechanisms by the health district. But if we get to the point where somebody says, not going to follow it, and Dr. Lutz says that's a risk to the rest of us, then I would be asking a court to issue an order to make that person stay out. And at that point, that person would be able to access the court and say, I think the district is wrong, and call their experts and do that whole process. But I think that's why we have such a conflict going on here, because we are overlaying an isolation and quarantine process that is broad into a specific school exclusion issue that we've never had to do before.
But, so my question for you, Michelle, is when the health officer gives an order to a school under 246.110, does the student have to be excluded at that point, or is it voluntary whether they go or not? Because that's I think where the confusion is the school feels like we now by law have to keep that student out, or they're in violation of our discipline policy, and that's where, and then that makes it's involuntary at that point if the school is keeping them out because they think they have to. But if it's really this second box where we're making a request that for health reasons the student should be there, should not be there, please comply, and then we don't have to do anything legally, and we're all good, we've heard the opinion, then it seems like the school shouldn't be mandating people, excluding them based on disciplinary issues at that point. And so that's where because it's I agree with you that it's not really super clear. So
It's not.
So whatever we decide, whether it's mandatory or whether it's voluntary, whether people go to school or not after a recommendation, then I think that's what needs to be communicated to the families and the school. It should say, hey, we're going for voluntary exclusion at this point. We're recommending this. We hope you'll cooperate, but if someone disagrees with it, then we'll take legal action. As opposed to feeling like if they show up to the school, they have now violated school policy.
Right, and as you and I have talked about, and I mentioned at the last board meeting, both you and I have struggled to try and figure out how all this is supposed to work, and it doesn't seem right to me that the parents that find themselves in this situation don't have any guidance on what happens next. And so that's why I had said, at the risk of overstepping last time, that I think it would be helpful to develop a what now kind of document, that when we have these school exclusions, parents know what happens next and what their options are.
Well, trying to put myself back in as a high school principal, and I'm concerned that I've been told by the health district officer that we need to exclude number X. And so at that point in time, I would ask the parent and the student to voluntarily leave with the exclusion. If they determine they're not going to leave, that's then when the health district officer has to take the appropriate action of doing whatever is necessary to get him excluded. Now, that's how I would look at it, as trying to do that as a high school principal, because the onus would be back on me, but I would, only on the fact that that's health district has determined who's going to be excluded. I don't know if that makes sense or not, unless I've made it more complex, I don't know. But I'm trying to make it as simple as possible, because I'm the one sitting there at the building of maybe 1,400 to 2,000 kids, and I'm having to make a determination immediately when the health officer said that student X needs to be excluded. And so do I go talk to that parent and say that on orders of the health officer, you have to exclude your son or daughter? And if they don't want to do it, then that is a different type of action that we would have to take in order to accomplish the goal. Now, is that kind of what this is all about?
That's certainly part of what that's all about. This is the straight isolation and quarantine steps.
Okay. Andrea?
Yeah, so
What this information here is actually clarifies what the quarantine isolation legally is all about. And so this information now will be given to those that need to do the letter to the parents. This information will be there for their due process. So I think what this does is this, now in the schools, since they didn't know that this was not involuntary, the schools and principals all thought it was something that was helping them, that this protects the rights of a group that is in minority, and that they know their legal process, and that after it becomes an order, then they have the 10-day process after 10 days, a new issue is required. Is that correct? For every 10 days, it can be removed and appealed to the Superior Court. Am I getting this right?
Yeah.
After 10 days, they can appeal. I think it just protects the rights. That is this, what is the evidence of the situation, and that just one group isn't just, okay, we'll just automatically off the board, just students who are.
Okay. Are there any more clarifications that we need? Do you want to ask Bob or Michelle?
Michelle.
Okay.
So anyway, I don't think you're overstepping your role at all to suggest that we put a packet together. I don't think this, like if I was a parent and I got this, I would not understand it. So I think we should. I think we should say, here is, regardless of all these things, essentially, we're issuing an order to the school district of exclusion. They have to cooperate. It's voluntary cooperation at this point legally. If it isn't complied with, the voluntary, then we would go to involuntary, and it's court, and these are your appeal rights. So I think we should have a plain language version of this that we give to the school district to give to people.
Step 1, 2, 3, 4, 5.
Yeah.
Okay.
Yeah. So. Yeah.
Okay. Okay, Bob, any else information? Any other questions of Bob? Thank you, Doctor. Okay, any other agency reports? Well, I think I'll go ahead now and make my, the chair's report. I want to do two things at this point in time. I want to recognize the people that have been serving on the transition committee, simply because they have done an unbelievable job of meeting, of getting all the information together to see what needs to be done, to make sure that we have the right administrator for the agency. They've been spending hours and hours and hours, and so I'm applauding them because we work so well together. And that makes such a great difference. In fact, that when we have a situation that we're facing, we can sit and talk about it and get it resolved and move forward. And so but their most important goal is one of making sure that we get the right person for the job. And we're going through all means of being able to do that. And I just want to say to each one of you, so Ann, who's been our liaison between the district and the committee, unbelievable job. She keeps us correctly informed, and our meetings, and when we have them, when we don't have them, and without her, we'd all be floundering because some of us would show up and not show up. Mary Cooney, the Spokane County Commissioner, the same way. Every one of them are absolutely unbelievable people that are willing to work hours to get the job done. Ben Rick, City of Spokane Valley. Thank you, Ben, for coming in kind of lately on this. But again, I think you discovered that it's not an easy job that we're doing. It's one that takes a lot of time and information and trying to glean. And Kevin Freeman, of course, that represents the small cities. Again, all these people are extremely qualified to do our job. And of course, me, I'm the least of qualification of that. And I'm leaving Karen Stratton for the last.
Because I went missing.
Because that there's times that I've tried to get Karen to come to the meetings at 6 o'clock in the morning.
Love that time.
And it's instead of at 7, and she just completely ignores me. She doesn't even listen to me. She just walks out the door when I mention 6 o'clock a.m. She just walks out the door. So you need to know I have one gripe about Karen. But that's the only gripe that I have about Karen. Do you have a story for us today, by the way?
A funny story?
Yeah.
Hold on. I didn't bring my binder with me. I have a statement.
Okay.
I've been telling all my friends about the benefits of eating dried grapes. It's all about raising awareness. Very nice.
Is that a junior high joke?
No, I think that's a higher level.
Oh, you
that's
could.
like
Oh, it is.
Maybe
Okay.
the doctor MD level.
All right. But the board has already received in their packet the pretty well an up-to-date current summary of what we've been doing since the committee started. And I'm going to read it to you so that not only that the staff that's sitting here and the rest of the board members are well aware of what we're doing, but also I know that we are being televised and will give the community a much better idea of the process that we're going through. And I know that Ann is going to make arrangements working with Kim where this report will also be, hi Kim, will be provided to the total staff here within the next few days or so forth. On September the 27th, Torney announced his retirement to the Spokane Regional Health District Board of Health Chair. Chair met with SRHD's executive leadership team the following day and constructed a communication to the board, SRHD staff, and community partners. The chair then sought membership for a transition committee and drafted a resolution for board approval. At the September 27th meeting, the board approved the committee's formation. The following day, the chair communicated with SRHD staff the board's decision, the committee's membership and responsibilities. So that's how the committee was formed. In October of 2018, the transition committee held its first meeting October 8th and met bi-weekly through the month of October. The transition committee's initial meetings included education on the agency's strategic plan, mission, vision, values, health, and policy, and SRHD's financial status and its culture. The committee sought feedback from the agency from staff, meeting with SRHD's executive leadership team and general staff for a combined total of 9.5 hours. Information received was used to shape the job description for the new administrative officer. There was a common theme that came forth from all our conversations with division heads and with staff. The committee, seeing the need for a smooth transition, identified Ray Byrne, Environmental Public Health Division Director, and Mike Riley, Chief Administrative Officer, Comptroller, to assume and share the duties of the administrator, allowing the administrator, Torney, sufficient time to complete transition work and assuring continued leadership after the administrator retired until a new leader was hired. October 25th, the board approved the temporary assignment of Ray Byrne and Mike Riley and according compensation to include SRHD executive assistant who assumed additional duties during this transition. The following day, the chair developed and released communications updating SRHD staff and community partners. In November, the committee met weekly to develop the position description and job classification for the administrator position. In shaping the job description, the committee met with SRHD staff affected by changes in the position description, SRHD Human Resources, and the SRHD attorney to assure proper development of job duties. The committee also reviewed administrative salaries from comparable health districts within Washington State and salary figures from the Civil Waters Consulting Compensation Project, which is reflected in the recommended job description. A representative from Empire Health Foundation met with the committee to offer grant funds to pay for the hiring of an executive search firm to recruit candidates for the administrative position. Discussions on the interview panel and process begin with further discussion to be held after the December 6, 2018 board meeting, where position description, job classification, and Empire Health Foundation proposal will be considered by this board. Now, this gives you just a small inkling of what this committee has been doing. As you can see, we just really are getting started. We now are looking at forming an agency. Agencies we'll be interviewing to see which one people to go look for somebody that would meet our requirements, someone that has a background in health administrators positions and so forth. So they will be the ones that will go out and search and find people and have recommendations for us. And with the Empire Health funding that we hope the board will approve in just a few minutes, we then have the monetary portion of it will be well taken care of. So that ends my report and regarding the transition committee. Do any of you have any questions? Okay. My next thing that I wish to do is I want all of you, let's see, Ann, are we ready to pass the chart? Let's go. If you'd pass out the chart cart. This is, by the way, this is a non-alcoholic drink. I want to emphasize that. Although there are times when I kind of wish there was more alcohol in it than not. So once you have your glass, I would like to have the board stand, please.
You can lay on me. Just about. Now you dry. It's okay. Oh, my right. Oh, it's your right. Just drag your other.
If you'd all stand. This is the last board meeting that Tony will be involved with us, because he's retiring come January 17th. Tony, would you come up here, please? I want you to stand right over there.
You're right in front, Tony, come on.
Okay. Yeah, go come on out there a little bit further. Okay, good. And so let's have a toast to Tony. Raise your glass, please. Tony, you will be missed. You have a great asset. You have been a great asset to the health district for so many years. We want to wish you well, and may you find much meaning and happiness in the next phase of your life.
Cheers.
Thank you. Cheers. We also have a little gift to give you.
Well, this is good. It is
A little gift, meaning there's a little package. Small gift, but I think that you, knowing you well enough, you'll greatly appreciate it. And again, thank you very, very much.
Thank you all.
Would you like to say something?
Oh, I will use this, thank you.
There comes lessons with that, you know.
Yes.
Tell everyone what it is.
Golf and hang with.
Oh, it's
Definitely be used, thank you.
Gordon, would you like to tell what it is?
It looks to me like it's 10 rounds of golf and hangman.
Oh, good. All right.
Utilized very early in the spring.
Okay.
I hang out there often, I get about 100 rounds a year.
Wow.
Very much appreciated, thank you.
Do you do 100 yards? How many times? Are you ever here? No, just kidding. Thank you very, very much, Tony.
Thank you.
At this point, you can make an inappropriate response.
That's right.
That takes care of the chair report. Let's go to consent agenda, meeting minutes of October 25th, 2018, and vouchers, October 1 through 31st, 2018. Do I hear a motion to accept them, please?
Move approval of the consent agenda as presented.
Second.
Second. All those in favor?
Aye. Aye.
Thank you very much. Now let's go to the action item number 8. We'll put this into a motion.
You didn't do the
Wait.
vouchers.
What? Did I forget something?
No, we did the consent agenda.
Yeah.
As in total,
Oh, including, okay.
including the vouchers.
Okay,
But do we have, are we moving the exec session?
I don't know. Are we moving the exec session?
Yeah, we are.
Okay.
Okay.
I knew I'd screw up somewhere. I just knew it. So at this point in time, you're responsible for the exec session.
Okay, so we're doing it now?
Yep.
All right, so we are going to have an executive session for potential litigation/litigation under RCW 4230-110-1I, and I'm going to say 5 minutes so that we can extend if we need to.
Okay.
Is that enough, do you think?
Yes, so.
Thank you, Chair. So in your packets today, you have two final draft items. One is a position description for an administrative officer. The other is a class specification for an administrative officer. Both of them are pretty similar. Basically, the class, Anne, you want to help me out? The class specification is for just...
It's more of an overview.
Overview.
And then the job description itself was actually more detailed about the duties.
So they're basically encompassing the same items. The change from administrator to administrative officer is twofold. One is administrative officer is the term of art under the RCW that defines this, so that brings us into line with RCW. Also, we had a lot of different, sometimes he was called the director, sometimes he was called the administrator, we had other directors, things like that, and we have a health officer, and we figured that it was appropriate to bring it into line and make our lead person the administrative officer. We spent quite a bit of time going through this, basing this off previous job position descriptions, but really working to attempt to very much define this person's duties, ensure that we are encompassing everything the person will have to do, particularly with respect to responsibilities of staff oversight, what they are responsible for with duties for management, evaluation, other items like that, what we have for expectations for internal facing duties and external facing duties, things like those sorts of items. And then the salary range that you see here is, as Mr. Hafner said, based on the salary study that was done and in comparison to other districts, health districts in Washington of similar size, taking into account that most of those districts are on the west side. So this salary range is competitive for the position and is competitive for the size of our district and the amount of items that the size of our district being the dollars that are administered and the staff that are managed. So if anybody has any questions on these, I would be happy to answer them at this time.
Hearing. Okay. Motion been made to approve.
I will second that.
Any other further discussion? All those in favor signify by aye.
Aye.
Aye. Those against? Thank you. This pass. We now then will go to Part B, approval for the Board of Health Transition Committee to hire a recruitment firm to recruit candidates for the SRHD administrative officer position. And again, before we make a motion, Commissioner Cooney will speak to that.
So, and I'll kind of speak to both B and C together because it was kind of a joint effort on that part. But I want to recognize Brian Myers from the Empire Health Foundation, who came and spoke to our transition committee and talked about that, their thoughts that they're here for the community, for the health of our community, and so that they would be willing to help participate
funding-wise in having a recruiting firm come and work with us to do a search. And so with that, we had a long talk at the transition committee about that, because it tends to be expensive. It tends to be about a third of the salary is the cost of a recruiting firm. And so was that something we needed to do or not do? Because of the position, it's a key position to our community health, that we felt that looking at a recruiting firm to get a good pool of candidates would be the right choice. And so we wanted to bring that back to you for that, and look to seeing if we could seek a grant from the Empire Health Foundation to then provide that funding for the recruiting firm. And so the first motion is to approval for the Board of Health Transition Committee to hire a recruiting firm to recruit candidates for the Spokane Regional Health District Administrative Officer position.
Are you making that a motion?
I can.
Okay.
I'll second that.
Second?
Second.
Okay. Any discussion regarding that? Committee, do you want to add anything to it that may lend to why the rationale for that? Why it's so important for us to have an agency that has the expertise not only of looking at prospective candidates, but their organization may have the expertise in health and administration, and that's one of the things that we're looking at. So,
He just said it.
I know, he did.
Good job.
And there's, I'll just say, and there's definitely, there's three, for sure, three firms that are national firms that deal with this, and Empire Foundation has done this type of search for other organizations, so that's part of why we felt that they would be a good partner in this.
okay. All those in favor?
Aye.
Okay. Now, did you put B and C together?
No, now I'll do
Okay.
a separate motion for C.
Okay.
So
We
then
accepted D, all right.
So the second motion for this, as I discussed, is the approval for the Board of Health Transition Committee to request and accept grant funds to be used to hire a recruitment firm.
Okay. Discussion? Committee members, any discussion regarding it? Okay. All those in favor?
Aye.
Okay. I couldn't believe someone being against it. It's money in our pocket. Okay. Okay, Mike, I think you're on next, aren't you?
Sue.
And D?
Sue Winters.
Or who's speaking to that? Sue? Okay. Yeah, I thought they had changed it.
So Resolution 1808 is to authorize the 2.9% COLA for our PTE represented employees, which are probably 80%, 75% of our employees, as well as the cost of medical increase, and do the same for the non-rep. Our WSNA union represented employees are still in negotiations. We don't meet again with them until the 12th of this month, and so this resolution is for PTE and non-repped. We did kind of get marching orders from the board and the parameters on the dollar amount at the September meeting, I believe, and we stayed within those parameters. Mike made sure of that with his financial obligations.
Any questions of Sue?
I have a question. There's no money announced there.
I believe the board authorizes was $485,000 combined between the cost of living increase. The 2.9% is based on the CPIU, which we've traditionally used since before I was here.
What about the medical?
And the medical amount, it's hard to put a flat dollar amount because the health district has traditionally paid the full cost for employee only on the lowest cost traditional plan, and then there's tier split and there's multiple plans to select from. So the dollar amount increase on the medical with the COLA stayed within the parameters that the board gave us.
Any other questions of Sue? Kate, did you raise your hand or your?
No, I
Yes. Okay, thank you. Ben?
So this isn't a renewal for the contract, this is just a resolution identifying the rate increase or COLA for?
This PTE, we had a reopener for COLA and benefits for this year. Their full contract's not open until next year. WSNA, that's not part of this, we are in full contract negotiation with them right now.
Okay.
Move approval of 1808 as presented.
Okay, second? Okay, all those in favor?
Aye.
All those against? Thank you.
Sure.
Okay,
Sure.
now
Hold on.
Mike.
Back in May or June, Torney approached you and talked about that we were going to look at a compensation study. One of the requests that was done by the unions and by the staff was that we went out and found a third party to do some of the work on this compensation study. We found over the course of time it's usually good to do a compensation study 3 to 5 years, in order to just sort of keep out how you're doing comparing to other health agencies, other businesses, depending on the job and the position you're studying. So the last one we actually did was back in 2004, 2005, 2006, in that range, and it was done over a 3-year period with some increment changes to some staff. We were looking to do another one within that 5-year plan, but the unions and had asked us to hold off on that, one until sort of the economy came back around. And so they both did agree that moving into 2018 that we could go do the compensation study again. So I just want to give you some little details about the compensation study, and then I'll tell you what the resolution is sort of about as we're moving forward. The why, there's always the why are you doing this? As I just was saying, it's always good to see how we compare, especially to other local health jurisdictions. When you're comparing to Snohomish or Pierce County, it's always good to see what are they paying compared to how we pay as far as for that type of position, or even some local places like the Spokane County or City of Spokane, what are they paying for certain positions that have the same type of positions. As I mentioned, we did want to do an objective third party, so we had put out an RFP and came back with a few choices, and the one that we chose was Siegel Waters Consulting. They're out of Dallas, Texas, and they have lots of experience, over 75 years experience of doing compensation plans for all kinds of industries, but especially they've also done public entities like ourselves. And so it was good to have them do this. We did have an internal team that was to help guide along, which consisted of Torney Smith and Sue Winters and Debbie Blair and myself. But the work, all the work that was done in the back on the project was done by Siegel Waters group. And so as they moved along through the process. Excuse me. Some of the objectives we're trying to do, as you can see, is that we're going to look at all our job classifications and make adjustments as we see needed. They were going to go down and do a market survey and get data from various entities that are similar to us. And then, as you see the other things going down, they're going to come up with some recommended pay strategy and compensation philosophy. So internally, we had all managers look at the position descriptions, redo position descriptions based upon what they wanted that staff to do. No matter what they were called, that's what went out, and Siegel Waters took that position description, not their title, but took that out to the other entities and said, do you have positions that do this type of work? What do you call them? What do you pay them? What other benefits do you give? So I think it was a very professionally done work done by Siegel Waters, and we were very proud of the work they did. Some of the outcomes that came out of it was Siegel Waters did come up here and gave 3 presentations. They gave a presentation to the executive leadership team for an hour. Then a little while later in the day, he gave a presentation to the joint management, which is all the mid-management and upper management, including the executive leadership team again. And then the third one they did was to the union representatives. So they went and gave sort of the a high-level update of where this was landing and what direction it's coming. One outcome that I really want to point out is that no employee is going to lose pay over this, and that no positions are going to be eliminated. It wasn't to try to figure out what level of staffing we have, and that's trying to figure out if we're paying the people the right level to move on. As you can determine, overall, when they looked at a roll-up, in overall general, if you roll all the positions together and all the results together, we actually were doing pretty well. We were either at market or a little above market in most classifications. So, and I think this comes from all the great work that Sue and her staff have done over the years of, we had a philosophy of how we did check against the other health jurisdictions and the likes, and so this showed that was. But as you can imagine, there were some that we were either above, that's what we were already paying above on, and so the outcome from the group was to place people into a new salary ranges and a new salary structure, and determine where those lied in there. So as we're moving forward, one thing I wanted to show you was the market data sources that were chosen were the ones you can see there. This also shows you how the cost of living adjustment, as I mentioned a moment ago, if we're going to compare to King County, we have to take an adjustment off the pay for the cost of living for living in those areas. And so those were adjustments that were made as we went through the data, moving along the way, as we got the results back on the item. One thing that we're very proud of, as you can imagine, is our benefits aligned or exceeded all the other markets. So all the other comparables that we went and looked at, we do pretty good on our benefit package here at the health district. And so we were really looking at pay and benefit as a total, not just salary, as we moved along. The reason that's a quick and dirty version of this is we're still in negotiations. So I want to talk a little bit about why this resolution's here today. This resolution's here because I knew that we were bringing the salary and the COLA resolutions to start on January 1st. We had intended this compensation study to start January 1st as well. So as we got the results back in November, we were trying to move forward with getting this implemented. And we got a letter from PTE saying, no, they want to negotiate it. So even though the unions had agreed to the philosophy of how we were going to do it along the project, they wanted to see the results and they want to and look through there. Well, I was still trying to keep the promise of we're trying to implement this by January 1st. Well, because of board meeting December 6th, and some of the unions not meeting, and they met once, FPT did, but now they're going to want to meet next week to see the final results of that. So I talked to our attorney, Michelle Fossum, and said, how do I write up a resolution that states what we're trying to do? We want to get this started January 1st if we can for the non-reps, because we can just start that one as long as you pass this resolution today. And can we get the PTE starting on January 1st if they agree to this next week? So it's actually, I'm coming to the board first before they have a chance to meet. And the reason when I was doing that is the next board meeting is until January 25th. And so if the resolution for any reason is not moved forward, then as soon as I could bring this back to you, it'd be January 25th with the final results and be able to start February 1st. So the other part about this resolution that I want to point out very much, the change isn't a great big change. It does affect some personnel out there, but the whole total comes to about $198,000 as far as the change in dollar value. But I'm not coming and asking for $198,000 more expenditure authority for next year. I think we can start this January 1st, implement it, and there'll be enough savings over the year to absorb that in our budget as we had it out there. One thing that we hope is because this compensation budget or study was done right now, there's not going to be a whole bunch of little groups coming and say, we want to look at ours again, look at ours again, look at ours again. We're sort of built into this that there's no appeal. So once this comes out from this third party and we implement it, that's how it's going to be for at least 2019 and moving into 2020 before we start looking at comparables again. So my request is, just a discussion on whether I can move forward with this resolution to start non-reps beginning January 1st and PTE represented group if they agree to it next week.
Any questions of Mike? Did you raise your hand? No questions of Mike? Do I hear a motion?
I'll kick the process. I move approve Resolution 1809 as presented.
Second.
Any more discussion regarding that resolution? All those in favor signify by aye.
Aye.
Those against? Thank you very much.
Thank you.
Thank you.
Linda, I guess, please.
You can leave it. That's a nice background. Just leave it up there. No worries, I don't have one, so.
All right.
Don't apologize. Good afternoon. So we have Resolution 1810, which is adopting the Board of Health's legislative agenda. We've been working on this since September, so hopefully things are looking okay. But if we can get a motion and then have discussion about any amendments that you might want to make, we can move this forward.
And I'll just comment on behalf of the committee. We did take the feedback that we got and put suicide prevention and mental health substance abuse in the top tier, even though we didn't necessarily have a particular bill that we were running yet, but that seemed to be the will of the board. And just again, reminder, the top tier are things that we're working on actively, including leadership when necessary, and Tier 2 are things that we're partnering with other entities. Tier 3 is really more informational, but they seem to be important issues regardless of how we feel about any particular outcome.
Thanks.
Any questions of the committee? Or of Linda? Do I hear?
I move that we approve the legislative agenda.
Do I hear a second?
I'll second.
Seconded. Any further discussion? All those in favor signify by aye.
Aye.
All those against? Thank you very much.
All right, thank you very much. A couple things to note. I will be sending out the legislative agenda to our legislators, and I've already been meeting with some of them, and I have a few more meetings set up for the rest of the month. I will be getting you talking points on these items, particularly the highest tier, in hopes that you can engage in some of the advocacy efforts. And just a final note is Public Health Day in Olympia is March 6th. If any of you are able to join us, we'll be headed over and meeting with our legislators to talk about these issues. So, thank you.
Okay, thank you, Linda. Let's go to number 9, please, the election of the 2019 chair. Let me read you a resolution 18-02, and one statement out of one of the whereases. This is whereas the Board of Health recognizes that leadership of the Board of Health can more effectively be determined by the succession of the vice chair to the chair position. That being the case, I do open up nominations for the chair for the Health District. Do I hear for any nominations?
I nominate Brian Beggs for chair.
Do I hear a second?
Second.
Second. Any discussion? All those in favor signify by aye.
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 Congratulations.
There you go. It's like, how's he voting?
Oh, dear. Now we're open for the vice chair. Again, under the different resolutions and so forth, they say the board shall elect a vice chair who shall serve for a term of 1 year from the members of the board who are elected officials by a majority vote of the board members present at the last regular meeting of each year. If a vacancy occurs, the new vice chair shall be elected to fill the unexpired term at the next regular or special meeting of the board. No vice chair shall succeed him or herself for more than 2 full consecutive terms. So, do I have a nomination for the vice chair?
I will nominate Ben Wick from the City of Spokane Valley.
Do I hear a second?
Second.
Are there any other nominations from the floor? All those in favor of Ben Wick being the vice chair, signify by aye.
Aye.
All those against? Okay, thank you. Congratulations, Ben and Breen. 2019 will be a great year. Board member check-in. Kate. Josh? How was the party, Josh? Didn't you have a party?
It was fantastic. Yes, no, today we had our annual holiday party for all the county employees. That's why Commissioner Cuney and I were a little late, but fantastic. Something we love to do every year to show that our most important resource are those that work at the county.
Oh, well, good. Thank you for all that. Doctor?
Here.
Okay. Kevin?
Nah, got nothing.
Ben? Andrea?
Well, I was part of the opioid task force and the steering committee, talking about committees that are coming about out of that, and looking at having sectors from all 12 sectors out of our community, representing a broad base of folks at the steering committee. And I think that there's going to be good movement going on with addressing opioids from different vantage points of our community as we talk about prevention, treatment, law and justice, that we all have to come together to help reduce the impact of opioids. Yesterday I was, or let's see, what day is this? Tuesday, I was in Olympia with the Office of National Drug Control Policy, meeting with HIDA, High Intensity Drug Trafficking Area, and Drug Free Communities Coalitions. And the one thing I really wanted to share about that is that they were from DC, the folks who were there talking with us, and they kept talking about health. How does law enforcement connect with health? It's the first time I've heard them use that term when we talk about substance misuse and mental health issues and the drug-free communities grantees that were in the room. So I think we've got a movement towards more health discussion rather than just talking about drugs, alcohol, marijuana, opioids, and mental health issues. So I appreciate that.
Two quick things. One, you might have noticed that the city of Spokane was short of a lot of shelter beds for 3 months this fall. They're now coming online. Staff has worked really hard once we got the mayor's office to get them to work on that. But as you can know, it's a kind of a Band-Aid situation, and it's not the 24/7, which means they don't have a place to keep their stuff. And so that's a challenge for people. So we're continuing to work on that. And then the second, going off the substance abuse, I just been thinking lately, and I hope I just throw this out to all of us and staff, that we in 2019 can, as a health district, come up with, our top 5 to 7 interventions that we think will move the dial, so to speak, on both substance abuse and suicide prevention in our area. I just think we should, instead of, like right now, we just have those topics on our legislative agenda, but we don't know what it is that we're asking the legislature, and we don't know what it is we're asking our local jurisdictions. Like, what could we do locally within our current means and legal power? So I just throw that out for thought.
As a chair, you'll be able to bring forth that information.
Yeah.
Salem, I was just going to add, Salem Lutheran Church on Broadway is opening up the 60 beds on Friday, so that would be tomorrow. So that's the second one. That's all.
I just want to remind everybody that we were having a transition meeting tomorrow morning at...
I'm going to start twitching.
Monday, honey. Monday at 7 a.m., Karen. Just as a reminder for everybody. Do I hear a motion to adjourn?
So moved.
Second.
All those in favor?
Aye.
Okay, thanks, everybody, and Merry Christmas, and Happy New Year.